People often ask, what's joint preservation? Seems ill-defined. In a nutshell, I'm trying to keep a knee replacement out of your knee, out of your life, for as long as I can. Cartilage damage in your knee is a little bit like a pothole in a street, and potholes are not great. They're not great for your car, they're not great for your knee joint, and they can grow over time. With all the preoperative workup, MRI scans, maybe an arthroscopy, we can figure out what would be best for your specific situation. In some patients, they have an issue with the underlying bone. So it's really the surface and the foundation underneath, if you will. One of the repair techniques is osteochondral allograft transplantation. And that's essentially taking cartilage as a plug of cartilage and bone from a donor and transplanting that into the defect. Depending on where the defect is located in the knee, you make your incision, you expose it so that you can see what you need to see. It's not like the old days where we made gigantic incisions. Luckily, we can do this much more minimally invasive these days. We look at the defect, and first we get a sense of how big is the defect. The next step then is preparing the cartilage defect. That essentially is coring out the area of damage, and then essentially go to the graft, make a plug of cartilage and bone. And when the graft is prepared, I take some of your bone marrow, I add that to the graft, and then the instrumentation is such that you really get what's called press-fit fixation. So 9 out of 10 times I don't need any screws or little darts to stabilize things. The plug just goes into the created hole and is stable. And then over time your body grows in and makes it your own. It's generally day surgery, unless we do other bigger things at the same time, and you end up on crutches for about 4 weeks, but you can move your knee. Patients often ask, isn't there a risk of rejection? Can I get a disease from the donor? And luckily, both. That risk is very, very low, and especially on the disease side, almost non-existent. Nothing is 0%, unfortunately, in life, but I always tell patients, at least driving to the hospital is more dangerous than having the surgery. And the success rate long-term is very good. So depending on your specific situation, it could be anywhere between 80 and 95% success, even up to 20 years.